we've heard that with Jodie, she did not need to have a colostomy bag, and I think that that is probably related to the location of the tumour being high enough in the colon that the bowel could be joined back together when the tumour had been removed. Is that the case, that it's all about the location of the tumour that determines whether a patient has a bag? And my next question to you is, for patients that you take to the operating room who you know will need a colostomy, what physical and emotional support is done before the surgery to prepare them with having a colostomy bag?
To answer the first part, pretty much I would say all of the colon surgery particularly will not need a colostomy, whether it's permanent or temporary. When we're working with the rectum, which is the very last part of the colon, the last 15 centimeter, sometimes we may have to do a temporary, actually it's an ileostomy, which is part of the small bowels, just to protect, the connection that we had. And, there are some, portion of the patient that we have to have them do a permanent colostomy. If that is determined pre-hand, we usually do have the patient see the stoma nurse, and they do multiple visits with them because that helps a lot in anticipating what to have and what to do. Again, usually experience of the patient with a family member is not what they're gonna have. And it's always good to sit with the patient, with us, with myself, and the ostomy nurse to see what to expect, usually give them handouts, give them some videos to watch, and guide them to websites. There are trusted websites. And they do what's called a marking, because we really want to know,
right.
Some patients, they do have skin creases.
Right.
They tend to wear their pants higher. So we want to make sure that we place the stoma, especially if it's permanent, in a location appropriate for the patient.
And occasionally patients do end up on the operating table with a bowel cancer that's caused obstruction of the bowel, and they're in the situation where they need an emergency colostomy. So this pre-marking, pre-planning, often there isn't time because it's an emergency procedure. And it's a difficult situation for patients to come to terms with having a colostomy, period.
Yeah.
But a lot can be done to improve quality of life for patients if the appropriate planning is done before. You've already talked about marking so that the colostomy is situated in a position that the bag is not going to leak because it's been poorly positioned because of skin creases. That's very important.
And that's been backed up by data, actually. There are some studies that showed that if the patient had the preoperative teaching, the satisfaction is higher, and then the rate of the patient having to come back to the hospital for any complication is a lot less if they're well informed about their colostomy beforehand. So that's data backed up as well.
One question before I come on to Jodie. If a patient says to you, I've got colon cancer, I know I need this tumor removed, do what you need to do, doc, but I don't want a bag. Whatever you do to me, don't give me a bag. How do you answer that question?
That's definitely a difficult situation.
You send them to me, don't you?
I have had that patients before. Usually we see it in the males, stoic patients that they don't want to live with that. And I think a big part of it is, like I said, the counseling. Usually they said absolutely no because they had a family member or a friend with that it was debilitating. Again, usually counseling with me and counseling with the ostomy nurse helps a lot. If they're still 100%, refusing the stoma, then there are some other options, but they have to know that it may not be the standard of care or the usual standard of care that we perform here. But there are some other options that are less the treatment-wise that can be done. But again, I think most of the time the patients, when they say that, it's because of the bad experience.
Right. And at the end of the day, as a surgeon, if we can get a patient through colorectal surgery without a bag, that's also one of our primary goals as well.
Absolutely, absolutely. That's one of the main things that we strive for, to do appropriate cancer surgery without having the patient have a permanent colostomy.